We're here in Ivano-Frankivsk, Ukraine. It's October 2023, and the war in eastern Ukraine is still raging. We're not there, but we see the effects of that war here in this regional hospital. The injuries that we see in war trauma really are devastating, much more so than the usual types of facial trauma we might see in North America. And oftentimes, unfortunately, what we have to do is reconstruct the eye socket, or they've lost their eyeball, they're blind. And in many cases that we've seen this week, blind in both eyes, so that at least they'll be able to fit with the prosthesis and have a more normal looking appearance. All of the soldiers we see are special, but I guess some are even more special than others. There's one young man here by the name of Andre who was severely injured. He's lost the use of both forearms through amputations, so he has no hands or lower arm on one side. He's blind in both eyes and has severe facial injuries.
So this is the first time that I've ever seen these kinds of war injuries. So these are just incredibly complicated, very difficult, challenging cases, and seeing these injuries in these poor young guys. As a mother myself, that is somebody's son, somebody's husband, somebody's brother. It's just so deeply, deeply sad that this is happening in this country and that it's undeserved.
We have had so many impressive and emotive stories from the soldiers that we've seen this week. Every one of them has a story to tell, one that is compelling. Many of our patients extend gratitude. They want to shake our hands. They want to have our photographs taken with them.
Я думаю, що їм приємно отримати цей знак. А це та бригада, в якій я служив. І бригада, вона дуже, як можна сказати, дуже хвально воює.
We have so many complicated cases, and for us it's complicated, also for our colleagues it's also so complicated, so we are waiting for you, for your help, for our friends from Face the Future. First of all, we are helping our patients, our soldiers. Secondly, it's that we can study something new from our colleagues from Canada and USA.
Today we have 2 cases of facial nerve reanimation, and the colleague from Kiev and another city mentioned that we don't have that kind of specialist in Ukraine who can do this operation. It was the first in Ukraine, but in this hospital is also the first. It's very difficult, it's very unusual. We have so many patients with this trauma, and it will be very useful for us, because now we know how we can help this young man and woman.
We are really very thankful. I should say for us it's extremely important, because it's just a revolution in our surgery because the doors became open.
It's really important when you're bringing that breadth of surgical training here and teaching these surgeons this whole new world, essentially. You don't just abandon them. You have to keep coming back and solidifying that and being available to them if there is a complication from one of these surgeries that they never do, so that they can manage it.
Жити впевнено в собі, впевнено в майбутньому. І це дуже добре. Ми бачимо очі наших щасливих пацієнтів після таких місій. І ми розуміємо, що треба ще і ще.
They're so grateful for the support. They're so grateful that the world recognizes what's happening here and that people like us are here to help them.
I see trees are green and red roses too. I see them blue for me and you. And I think to myself, what a wonderful world.